Mental health, homelessness, and misconceptions. Love and family do not solve mental health issues. It is harmful to think that mental health issues can be cured or solved. The more appropriate perspective and language is that they can be addressed and managed. None of the following factors alone solve mental health issues: love, family, shelters, police intervention, mental health facilities, medicine, money, kindness, patience, positivity, and prayer. Hi, my name is Joannis, and today I'd like to set something straight regarding mental health or mental illness and homelessness. My family and I have been navigating the journey of supporting a loved one with mental illness for well over a decade. My academic and professional path has been rooted in the mental health field. One of my deepest passions is educating, advocating, and raising awareness around mental health. Over the years, we have heard many well-intentioned but ultimately unhelpful comments. Such statements often reflect a lack of understanding and can be unintentionally hurtful. Why don't they just get help? Why don't you help your insert family member? Why can't you just take them in? Why don't they just go to a shelter? Why don't they just get a job? But they seem normal or coherent. Those suffering can and do have moments of coherence and normalcy. The measure for mental illness requires far more than small moments that some may capture or witness. But they're so intelligent. Assuming that mental illness means a person is not intelligent is ignorant. For example, imagine you go on vacation in another country where you don't speak the language. Would it make sense for people to assume that you are not intelligent because you don't speak the language? No, it doesn't make sense, right? So let's stop doing that. Yes, mental illness and homelessness can happen to you. Sometimes all it takes is a single traumatic experience to permanently alter someone's mental state. Regardless of your background, age, how functional or loving your family is, how careful you are, etc., many aspects of life can lead to lasting cognitive or emotional challenges. Mental illness can be triggered by countless factors. And guess what? Genetics is not the biggest cause. The following factors are: stressful life events. Yes, you heard it. Something as simple sounding as stressful life events. PTSD, abuse, a fall, a fight, assault, an accident, a stroke, basically anything leading to TBI, which stands for traumatic brain injury. Environmental influences, personality traits or developmental conditions, brain chemistry imbalances, alcohol or drugs, especially those that are synthetics or laced substances, genetics and family history, prenatal or birth trauma, such as being stuck in the birth canal. While forceps can be a safe tool when used correctly, complications like brain or nerve damage can occur, potentially leading to developmental delays, cognitive impairments, and emotional or behavioral challenges in the child. This is traumatic for both the child and the mother. Traumatic experiences and head injuries can disrupt the delicate balance of neurotransmitters, or brain chemicals, that play a crucial role in mood, mental well-being, and can lead to things like depression, anxiety, post-traumatic stress disorder or PTSD, bipolar disorder, obsessive compulsive disorder or OCD, schizophrenia, dementia, Alzheimer's, and other issues such as anger, mood swings, substance abuse, and behavioral problems. The reality of mental illness. Here is something crucial. Mental illness does not appear overnight. It often begins subtly with gradual shifts in personality, unusual behaviors, or changes in social interactions. Then it escalates. Patterns begin. Intensity grows. In the process, reality can easily intertwine with a distorted perception. Many of the systems meant to help people can easily end up re-traumatizing a vulnerable population. This is why you hear of horrible stories of abuse in places like elderly or retirement homes and mental health facilities. If you've never had to navigate the maze of police intervention, legalities, psychiatric care, homelessness, or trauma, it can be hard to understand. The truth is, people and brains are complex. Life is complex, and the system set up for mental health is complex. You cannot look at someone's homelessness or mental state and say, well, I would never let that happen. You don't know what you'd do if it were your child, sibling, or parent. Because this doesn't just happen to them. It can happen to you or anyone. Mental illness and homelessness are a common combination. Some of these mental health systems only offer help if someone meets a very specific and often unrealistic set of criteria. If they don't meet that, they don't get treatment. And that's why you see so many people on the streets. Mental health programs often only compute two categories: willing to get help and suicide or harm to others. Many mental health conditions come with a lack of insight known as anosognosia, which means the person literally doesn't believe they are sick. Their brain tells them, don't trust anyone and don't get help. Mental illness and homelessness are not personal failings. The issues that remain in regards to mental illness are systemic. They are medical, and we need better infrastructure for care. We need more advocating, thoughtfulness, more willingness to learn, and more compassion. Shelters alone are not necessarily helpful in treating an individual's unique case. Most shelters have a mixed population. Many mentally ill and homeless people are fragile and vulnerable, and more often taken advantage of and abused than the other way around. People often lump homeless into one big general category instead of seeing individual human beings with unique contributing factors. Disorders like schizophrenia, bipolar disorder, PTSD, and others often come with comorbidities. That means when two or more medical conditions exist. One condition worsens the symptoms of another, and treatment is not one size fits all. It can take months or years to find the right therapy, the right medication, and the right dosage. And you can't do any of that if the person is terrified, untrusting, or living on the streets. And lastly, stop with the performative help. This is the act of appearing to offer aid or support without providing genuine assistance, with the primary goal of improving one's own image, social capital, or reputation, rather than addressing the actual needs of the person or the cause being supported. It involves actions that are superficial or symbolic and lack tangible impact, such as posting on social media without taking real-world action. This is harmful and unproductive. There is no need to talk the talk and not be prepared to walk the walk by taking significant and impactful actions.